Case study number 3. Summary. Mark Wilson, a 28-year-old male. Mark presents with severe abdominal pain, fever, and nausea. He has a history of appendicitis. Current situation. Mark arrives at the emergency department with severe abdominal pain localized to the right lower quadrant, fever, and nausea. His vital signs are: blood pressure 130/80ths of a millimeter of mercury, heart rate 100 bpm, respiratory rate 22 breaths per minute, temperature 38.3 degrees Celsius 100.9 degrees Fahrenheit, oxygen saturation 98%. Questions. Question 1. What are the potential diagnoses and pathophysiology for this patient? Answer A. Acute appendicitis, inflammation of the appendix, often due to obstruction by fecalith or lymphoid hyplasia. Pathophysiology involves bacterial invasion, inflammation, and potential perforation. Symptoms include right lower quadrant pain, fever, and nausea. Key points include timely surgical intervention to prevent complications. Answer B. Gastroenteritis. Inflammation of the stomach and intestines, often due to infection. Pathophysiology involves viral, bacterial, or parasitic infection causing gastrointestinal symptoms. Important considerations include hydration and symptomatic management. Question 2. What immediate nursing care is required for this patient? Answer A. For acute appendicitis, administer pain relief and intravenous fluids as prescribed. Monitor for signs of worsening symptoms or perforation, such as increased pain, rigidity, or guarding. Prepare the patient for possible surgery and educate them about the procedure. Answer B. For gastroenteritis, provide oral or intravenous rehydration therapy as needed. Administer antiemetics and antipyretics as prescribed. Educate the patient on the importance of hydration and infection control measures. Question 3. What diagnostic tests and treatments are necessary for this patient? Answer. Complete blood count (CBC) to assess for signs of infection or inflammation, for example, elevated white blood cell count. Abdominal ultrasound or CT scan, to visualize the appendix and assess for signs of appendicitis or other abdominal pathology. Urinalysis, to rule out urinary tract infection or kidney stones. Electrolyte panel, to evaluate for dehydration and electrolyte imbalances, particularly if vomiting has been severe or prolonged. Medication informations. Antibiotics, for example, ceftriaxone. Considerations. Monitor for allergic reactions and educate the patient on the importance of completing the full course if discharged with antibiotics. Side effects: diarrhea, allergic reactions, and potential for antibiotic resistance. Contraindications: known allergy to cephalosporins or penicillins. Analgesics, for example, morphine or acetaminophen. Considerations: monitor pain levels and watch for signs of respiratory depression with opioids. Educate the patient on appropriate use. Side effects: constipation, nausea, and sedation. Contraindications: severe respiratory depression for opioids, liver disease for acetaminophen. Antiemetics, for example, ondansetron. Considerations: monitor for effectiveness and educate the patient on potential side effects. Side effects: headache, constipation, and fatigue. Contraindications: known hypersensitivity to ondansetron or other 5-HT3 receptor antagonists.